Well, October is Breast Cancer Awareness Month. 1 in 8 women will be diagnosed with breast cancer.
And one of those women was our own Amy Johnson. She's here now to share her story.
Well, today is a special day for me. It's an anniversary. It was 5 years ago I got the news that I had breast cancer. And at the time, I felt so strong and healthy. It was hard to believe I actually had cancer. I share my story because I feel if it could happen to me, it could happen to anyone. October 7th, 2016 started out like any other Friday. I got the kids ready for school and headed to work. I was working on a local election story when my phone rang. The call from a doctor would change my life. The doctor said the test was positive, and I couldn't understand what he was saying. He said the biopsy was positive, and I said, "What?" And he said, "You have breast cancer." It was like the world stopped. I actually found my lump, got a mammogram followed by a biopsy, but I still couldn't believe it was cancer. There was no history of breast cancer in my immediate or extended family.
The vast majority of patients who develop breast cancer are in fact those without any family history or any predisposing factors at all. Over 80% of the women diagnosed with breast cancer do not have a predisposing risk or a family history.
1 in 8 women will be diagnosed with breast cancer. I asked Dr. McKellop, a radiologist and medical director for RadNet and Breastlink, which women are diagnosed most.
Both white and African American women are the most commonly affected. White women are at about a 13% lifetime risk of developing breast cancer. Black women are at about 12%. And then Asian, Native American, and Latinx women are at a lower frequency.
But African American women have a higher mortality rate, often being diagnosed with more aggressive types of cancer.
There are some environmental and some biological factors that contribute to this.
Today's the day. I'm on my way to UCLA to have surgery. I recorded a little video as I headed to the hospital for surgery 2 weeks after my diagnosis. And as I was prepped and wheeled into surgery, I still couldn't believe it was happening to me. I also knew how lucky I was that I caught my cancer early. My treatment consisted of a lumpectomy and aggressive radiation. The most difficult part is accepting that you're someone different now. You have to mourn the old life. I'm now part of a wonderful sisterhood of other women that are breast cancer survivors, but I'm also a person with a pre-existing condition. And sure, there's a little extra weight from all the medication, but I know that I'm on the other side, and it's all positive. Doctors say too many women have been putting off their routine mammograms during the pandemic.
But I am noticing that patients are coming in with palpable lumps that they're complaining of later than their annual screening mammogram. And the tendency is for these lumps or these findings to be larger than they otherwise would have been had they come in for their yearly screening.
This year, I celebrate 5 years since my cancer diagnosis.
It truly is a cause for celebration, if you will, and congrats to you.
The odds are in my favor.
At 5 years, you're at 6% of recurrence of the known disease, and by 10 years, you're down to 3%.
Now, throughout the year, but especially in October, I hear from family, friends, and even strangers who say they are getting a mammogram because of me, and that is truly the best outcome of my battle with breast cancer.
Yeah. So happy for you that you are where you are today.
Thank you.
And handled it with so much class and dignity. I remember when it happened, Amy.
Yes.
And we were all so worried about you, but there's something about talking to you, even at the time.
Yes.
You always said, "I'm going to be okay." And, you know, that's what it takes. You were such an example, I think, for all of us, and so happy for so many people out there that knew of your story, and they're getting a mammogram because of you. I'm going next week. But, you know, with all of our work with the American Cancer Society, it takes women like you to really keep the word out there.
And I certainly appreciated all the love and support that you all sent. Beautiful flowers, like meals. Everybody just took such great care of me.
Well, thanks for telling your story.
Really
it's not a hard one to tell, I bet. I mean, sometimes it's difficult
I
to
just
talk
hope
about.
I'm helping someone.
Yeah, good.
But she can do it. Thanks so much, Amy.
Thank you.